and these again are part of that parts number list that I gave you. These are endo tabs. Okay, basically you just stick them on the side of the sensor. At this point, I could go ahead and clip some hemostats on there, place it in the patient's mouth, have them hold the hemostats. Based on the angle of my hemostat handles, I know how to angle my tube head. Okay. One other method for the bisecting angle technique. These are available through our supply channels. This is a modified snap array. This is the only one we recommend using with these sensors. Okay. Basically, it works the same way. Your exposure side is going to be on the side that has the bite rest. You simply slide it on, lock it down, and then again you go ahead and position. Personally, I don't like to use these because you'll see how much image area you actually lose because of the thickness of the snap array. And you can only position it so far before it's non-secure and it actually pops out. Okay? So whenever possible, that's again why I try to use the holders. All right? Now, as I was mentioning earlier, the tongue is the best cushion in the world. So when you're doing, even with your anterior shots, when you're working on the lower, instead of trying to go underneath the tongue, go right on top of the tongue. When you're placing for the anterior shots, you're also going to have the sensor as far back as where the first molars are. Okay? Patient's palate is a little higher, so it gets a little more comfortable that way because we want to make sure that their upper and lower centrals are occluding on that bite block. And we usually kind of want it right in the middle. The newer ones actually have a little notch, so we kind of know where to gauge it at. Okay? Now, the cord. Some people worry that the patient's going to bite through the cord. I can tell you the past 15 years that I have worked with Patterson EagleSoft Chick, I've never had a patient bite through one. Okay? Never. All right? Okay. Any questions?